Hello, and welcome to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner, and I chair the Board of Commissioners Health Committee. Today, we're going to talk about food insecurity in Lower Merion Township. My guests are Dr. Winston George, the Associate Program Director of Bryn Mawr Family Practices Residency Program. Dr. George is a graduate of the program and has been an attending physician and leader in education for many years. Gigi Tevlin-Moffat is the founder and director of the Narberth Community Food Bank, serving all residents of Narberth Lower Merion. The Narberth Community Food Bank has been at the forefront of food insecurity and associated issues and solutions for 15 years. Dr. George, can you tell us what food insecurity is?
Yes. Well, in its most basic form, food insecurity is the state in which an individual or a household would lack access, or if there is some disruption, such as in our current pandemic, to their access to enough food. And in many instances, it's not just enough food, it's enough quality or nutritious foods for their basic needs. And from what we know, it may be influenced by a number of factors, such as age, income, employment, race, ethnicity, and certainly even disability.
What impact does food insecurity have on children?
That's a great question. Well, food insecurity really is, it's a public health concern as it affects our most vulnerable, right? I think some of the studies show that 1 in 6 children from US lives in a food insecure household. And in our children, food insecurity can lead to acute and chronic issues in their health. In instances where there's a lack of access to quality foods, it really can cause disruptions to eating patterns and can lead to poor weight outcomes such as obesity. And then if you look further down that path, without access to nutritious foods, there is a direct impact to the functioning of their immune system. And this certainly can lead to issues such as asthma and other frequent illnesses, which may require regular healthcare visits and sometimes even unnecessary emergency room visits.
Does it also affect the sort of behavioral health or mental health of children as well?
Of course, yes. So besides the physical manifestations of food insecurity, such as obesity and asthma in children, just the sheer stress produced by food insecurity can lead to behavioral issues such as the anxiety, aggression, and depression. And this, as we know, can lead to a negative spiral, which we know that anxiety, depression can further weaken our immune system.
It also creates bad habits for the future, which we know can go into adulthood and create those lifestyle illnesses like diabetes, high blood pressure. And until we as a society recognize that, all citizens deserve high quality, nutrient dense food, and that should be a human right for everyone. I think it absolutely needs to change our thinking that it's cradle to grave, that we absolutely have to recognize that a human right is to high quality, nutrient dense food. And until that happens, the charitable networks that are here today and others are responsible for taking care of our neighbors. And I think that we need good partnership. And I think this program, and of course with Dr. George, is absolutely a big step in connecting back to the community.
When children are food insecure, does it affect their school performance as well?
Yes, absolutely. I mean, in a state of hunger, just to focus is in itself a challenge. And so certainly with children who are coming from households where if their parents themselves are anxious or there's concerns of food insecurity, that can certainly be projected onto the kids, and the kids themselves can bring that into the school, and certainly performance would be significantly affected for that. And we see that commonly in our office as well.
Nationwide, a report came out, I believe it was last week, and there has been more than one, regarding students who are not receiving nutrient-dense food and their SAT scores and their performance in the classroom. It's shocking.
Yeah.
We've been talking about the effect that food insecurity has on children, but it affects adults as well, doesn't it, Dr. George?
Yes. Well, as mentioned, food insecurity is a public health concern, not just for our little ones, but also for our adults, given its association with multiple chronic issues. In adults, this would include type 2 diabetes, high blood pressure, high cholesterol, and poor overall cardiovascular health. Similar to children, our senior citizens are also vulnerable population, as food insecurity can lead to healthcare issues. In addition to anxiety and depression for our adults, food insecurity can lead to things such as loss in muscle mass, which can contribute to our elderly getting weaker and prone to falls and even severe injury.
Does Mainline Health have any special initiatives to address food insecurity and healthy eating?
Yes. So in 2016, Mainline Health started a program at the campus of the Lankenau Hospital called the Deaver Wellness Farm. Now, this is an incredible year-round organic garden, which not only provides a source of healthy foods for the vulnerable population, but also partners with the local schools to provide education on agriculture and healthy eating. So we're very much excited about this particular program.
I'm sorry I'm going to have to interrupt our conversation, but we're going to have to take a break. Dr. George, I want to thank you so much for joining us. We'll be right back with our other guests with more about food insecurity on Health Matters. Stay tuned.
Thank you.
Welcome back to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner and Chair of the Health Committee. We're talking about food insecurity in Lower Merion Township. Now, many people think that food insecurity isn't an issue in Lower Merion Township, but nothing could be further from the truth. We don't have accurate numbers of people who are food insecure in the township, but we do know the numbers are substantial. Approximately 10% of our public school students receive subsidized meal plans. Our county officials estimated before the pandemic that about 8 to 9% of our residents were food insecure. That's about 5,000 people in our township who struggle to have enough food and healthy food to eat, and all before things worsened in the last year and a half. Gigi, can you tell us about Narberth Community Food Bank and your experience during the COVID-19 pandemic?
Sure. First, Gilda, thanks so much for having this really wonderful show. The Narberth, we made a lot of changes. We had to, like every other organization, adapt to the numbers and adapt to the disease. And we had to really change our entire plan. We moved to a delivery model. We moved to serving close to 4 times the original the pre-pandemic amount of households. We had to time our volunteers in and out of the building. We had to have a cleaning schedule that was beyond our usual measures. I think that we increased our hours on Tuesdays. We were there about 12 hours on Tuesday, and then had an additional produce pickup day for those that felt that maybe they didn't have enough produce to last the week. So we really had to adapt to the changing guidelines and rules that came from the county, of course, and the CDC. But I think we learned so much from this pandemic, Gilda, as a community. You know, Lower Merion and Narberth, this is a community that absolutely pitches in and understands when things change that they have to get in the game. And we had so many more volunteers, folks just dropping off brown paper bags, folks saying, what little thing can I do? I'd like to get on Facebook and talk about what's happening. And I think there's a real understanding here that even though we don't have accurate numbers, that there really is a need to take care and protect our neighbors. And I think Lower Merion and Narberth responds to that wholeheartedly.
Well, Gigi, when we've spoken in the past, you've told me that you were feeding 300 to 500 people a week during this pandemic.
Yes, we were. So at the height, May, June, and July, there were 167 people in line, and they were representing their households. And that was an incredible thing. And
did they come from just Narberth or Lower Merion?
No, Lower Merion and Narberth. You are 10 times Lower Merion, 10 times the size of Narberth. So yes, but I want to be really clear across all demographics, across any category you want to pick. They were at the door and asking for food, as I'm sure the other organizations can tell you. There was no one group that was hit more than others. It was an across the board reaction that was happening in the public and in need for the food safety net system to come forward and to be that rescue point. And you're right, there were hundreds of people.
Karen, can you tell us what the experience of the Ardmore Food Pantry has been over the last year and a half?
Oh, absolutely. And thank you, Gilda, for including me in on this show. I really appreciate it. The Ardmore Food Pantry prior to the pandemic probably served between 70 and 80 individuals / families per week. We're only opened on Mondays. When the pandemic started, those numbers started to really increase, and we had gotten to as high as maybe 125 guests every week. That has now gone back down to about 70, 80 per week. So we have seen a change in that, but we haven't seen a change in the need of those who are showing up. We have people who are coming to us before the pandemic started, and we had a lot of new people who were showing up, and maybe a few more little kids than we had in the past. So we try to adjust things. We, like Gigi said, had to really redo our entire way of providing food to the community. I am very proud to say, because of the help of our volunteers, people who are donating food and people who are donating money, the Ardmore Food Pantry did not close on any Monday. We stayed open through the whole entire pandemic. We had been serving people inside our parish hall, where we gave them a really nice hospitable area to sit and chat with their friends while we were busy filling their bags with food. Now we pre-package the bags and we provide them to the people as they drive up in their cars through our driveway. We also provide the ability for people who are nearby and want to just walk up. We have another area where they can just walk up and get the food they need. We've also are providing to each family more food than we ever did before. We are now always having sources of protein, lots of produce, and what we call a supplemental bag or an extra bag of maybe some miscellaneous things that people had donated that didn't fit within our normal menu. The amount of we've had to limit the number of volunteers at any one day because there were so many of them and we wanted to take precautions. Before the pandemic, we had volunteers here at the church 1 day a week, and that was Monday. We now have volunteers here 4 days a week in order to try to get all the work done in preparation for Mondays. And I got to tell you, the donations of food just kept coming and coming and coming to the point where we were giving food over to other food pantries in Montgomery County. And the same thing with the dollars people donated. People were incredibly generous, and we've been able to do a few special things because of that. So it's a community place, and we serve, for the most part, Lower Merion Township. 70% pre-pandemic were from Ardmore. Now we're not asking people where they live. We just want to give them the food that they need. So we have some of our increases because of that. And we're thinking that we're going to continue to operate in that way. And while we have the funds and the ability to do so, anybody who comes to our door and is in need of food will get food.
I'm so sorry we have to interrupt again. We're going to take another break, and we'll be right back in a few minutes with more on food insecurity. Stay tuned. Welcome back to Health Matters. I'm your host, Gilda Kramer, and I'm welcoming Deirdra Mulligan for this segment of our program. Deirdra, what can you tell us about Mitzvah Food Pantry and its experience in the last year and a half?
Sure. Thank you for having me. It's great seeing everybody here. The Mitzvah Food Pantry is a network of food pantries in the area, and pre-pandemic, our pantries were set up to provide a choice model, which meant people could come in, pick and choose what they wanted based on their dietary needs. During the pandemic, unfortunately, we had to pivot very quickly and switch to a prepackaged model and have people only come in outside. We didn't allow people to come in due to safety concerns. We have the ability for people to order food from home. So if they were still able to do that, they are still able to receive those food packages. Also, during with some of the distributions that we were getting, we would get food that was prepared from the Jewish Family and Children's Services Kitchen, which unfortunately closed because of pandemic. But Lower Merion has been working to get funding from a program called HUD COVID-19 program, which is paying local restaurants to provide those meals that we were getting from that kitchen, and the other food pantries are getting this too from other restaurants, to provide these lovely cooked meals to our families. During the pandemic, we have seen a 12% increase in clients coming through. Doesn't matter race, religion, age, family size, we're seeing all walks of life just coming through. Our normal distributions were about twice a month, and now people need to come through 3 or 4 times more a month, and we're just being able to meet that need. Thanks to money coming from CARES money and things like that, the disruption in the food supply chain was not felt by our clients. We felt it. I'm sure Gigi and Karen felt it. But because of this funding, we were able to find other vendors to help us. So our clients were not feeling that. We did receive the Farmers to Family boxes that were provided by the federal government until they became more cumbersome to deal with. And then we had to stop accepting those programs. So we haven't seen a slowdown thanks to, honestly, from increase in SNAP, increase in the child tax credit. We're still seeing an increase pre-pandemic, but it has slowed down, which is a good problem. That means the clients are getting what they need.
Now, I know that Eldernet's Food Pantry also serves more than 100 households, and that their needs have grown significantly during the last year and a half. And in addition, there's a new nonprofit, Neighbors Helping Neighbors, that helps to support at least 70 food insecure families. And Reverend Kaminskas' Victory Garden program has been assisting a lot of individual families in growing their own food, which has also helped to alleviate this issue in the township. Most people would not think that the food and financial security would be that prevalent here in Lower Merion. Is there anything that makes food and financial insecurity different in our community?
No, we have the same problems as our friends in Philadelphia and our friends in Norristown, our community members in Pottstown. We just might have it over a nicer hedge and a different driveway, but we have the exact same issues going on as the rest of Montgomery County and Philadelphia County. Not at the same scale, but definitely the same problems.
Are there any particular type of life events that can trigger food insecurity for families?
Sure, job loss. Let's talk about early retirements. Let's talk about women being forced out of the workforce in this last issue, a health issue. There are a lot of factors. And the fact that every state around us has raised its minimum wage, but Pennsylvania has not, that's an issue. High school kids being paid as adults, the same prices as you now see seniors and adults working in places. There's something misaligned here, and it has to be addressed. And I think that everybody here would agree that we would want to create a partnership with you, local government, Narberth Council, and the township, as well as county government. And we need an advocacy and a voice in Harrisburg. When you count on the Charitable Food Network to fill in the gaps, then we have to be a partner with government in order to absolutely solve some of these issues the doctor brought up before regarding the long-term health of our community.
And the food that we're getting provided. The food that part of the reason why there were issues with farmers to families boxes were the quality was horrible and people didn't want it. They were being left. I mean, there was places in Philadelphia, they were just being left on the corners. So you need people to have a say in what they're receiving, and having those boxes were there really to save the farmers. They weren't really taking care of the families. And the same thing with a lot of the government food. It's like, okay, take what you get. And it's not meeting people's dietary needs, which is a huge problem.
Absolutely do.
Karen, you helped us to pioneer a special program last year, which is restaurant meals for the food banks with the Ardmore Food Pantry. Can you tell us a little bit about that program and how it has worked over the last year and a half?
Oh, certainly. And it has worked extremely well. I don't remember exactly when we started it, but I know when we did, we were asking a restaurant or a caterer to provide us with 80 to 90 prepared meals in a week. And we would make an order one week and then skip a week and then go to the other person the next week so we can spread it out a little bit. And it worked out well. McShay's was one of the restaurants that we worked with, and the caterer was someone who actually happens to be a member of St. Mary's, but has her own catering business. The food, people who were receiving the food really, really loved it because we got some really good feedback. And it was great knowing that you were helping not only the people who you were serving at the food pantries, but that you were helping out those restaurants and self-employed people who were trying to make a living through the pandemic. So I think it was a great program, still is a great program, and we appreciate it very much.
It really was an eye-opener.
Yeah.
Eye-opener.
Well, I know we don't have much time left, and I would like to ask each of you very quickly to tell us how we can, those of us who are not struggling, can help with the issue of food insecurity here in the township.
Yeah. If you have people who want to volunteer to pick up produce from Whole Foods or Trader Joe's, that would be helpful. To do some of the deliveries, that would be helpful. To do
Spread the word would be
this.
helpful. Tell people we exist and we're out there and we're ready to serve.
Yeah. Let people know that we're there to help them. That's what we're here for.
And people can donate to each of the organizations.
Mm-hmm.
Yeah.
Yes.
NarberthCommunityFoodBank.org.
Well, that's all we have time for on this month's show. I want to thank my guests, Dr. Winston George, Reverend Deacon Karen Kaminskas, Deirdra Mulligan, and Gigi Tevlin-Moffat for being in here, and also for the very important work that they do to address food insecurity in our community. I'm Gilda Kramer, and I'll see you next time on Health Matters.